teams, Lauren here with Bizrok. In this week's video, I want to talk to you about the overall clinical transition. Now, I know previously we've talked about whenever you walk out to greet your patient for the very first time, especially if it's a new patient, it's really important to avoid the awkward question of, hey, how are you? Because sometimes they'll tell you how they are and then where are you going to go from there, right? Plus, guys, you only have so much time with a patient. If it's a new patient, you want it to be super productive. So ask a more meaningful question. You know, previously in other videos, guys, we've talked about using the FOR method, that's F-O-R, which stands for family, occupation, recreation. Those are safe, but also more valuable questions you can ask your patient. So rather than asking, how are you? Which means half the time you're gonna get a negative response, half the time you're gonna get an unproductive response. So instead say, hey, you know, how'd you hear about us? Do you have family in the area? What do you do for a living? What do you like to do for fun in our city? Any of those family, occupation, recreation questions are really good starter questions. So clinical team, when you're going out to the welcome area to greet your patient for the very first time, one, I would make sure that you stop by the front desk. If it's a new patient, ask the front team members, you know, where's my patient? You know, which do they look like? That way, whenever you walk into the welcome area, you're not simply like shouting somebody's name and looking around aimlessly to see which patient is yours. Make that patient feel special, as if you and the front office team already communicated on exactly who your patient is that you get to serve, okay? So whenever you walk into the welcome area, you can go directly to that patient and say, hi, Susie, my name's Lauren. I'm going to be your dental assistant today. Come on back. See, now I've said their name. I've greeted them with a warm, friendly smile. I told them my name, my position in the practice so that they know they have the right person, whether they're for a hygiene visit or a doctor visit. You've got to tell them who you are, right? And then as you start walking them to the back, you ask them an important question, get to know them personally. So what do you do for a living? Oh my goodness, that's amazing. Or if it's a new patient, maybe you start with the patient tour so you can show off your office. Remember, the patient tour is like a walking, talking resume to your patient about what makes your practice unique and truly exceptional. So as you're transitioning the patient from the front, from the check-in area to the back, you want to have a really productive conversation. Again, this is important for a new or a recall patient. If it's a recall patient, hopefully you did your homework before you ever got your patient back and saw something that the previous team member spoke to them about, the previous hygienist or assistant or doctor. Maybe they recently went on a trip. And so last time they were in, they were talking about taking a cruise to Tahiti. Like, what an awesome thing to talk about, right? And so you can go right in and just say, hey, Susie patient, I know I haven't met you yet. My name's Lauren. I'm going to be your dental assistant today. Hey, I saw in your notes, your hygienist made a note that you were going to Tahiti recently. Like, how was your trip? That's amazing. And now you instantly have rapport. Now guys, here's the most important part and where I often see the ball get dropped and why I'm doing an entire video on it, okay? See, sometimes we forget to transition that information over to our doctor. See, as the hygienist or dental assistant, we do such a great job of building rapport and connection with our patients. But if we're not transitioning that connection to our doctor and building authority for the doctor, now the doctor's basically starting from zero and having to rebuild connection, rapport, and time with the patient, which in the grand scheme of things, guys, of course they can do, right? I've seen some phenomenal conversations with doctors who knew nothing about a patient, walked in cold, and instantly built rapport. So I'm not saying that. But guys, to run an efficient office, we've got to find ways to become more efficient every single step of the way. So as the hygienist, as the dental assistant, if we're able to help our doctor out and save them the 20-minute conversation about the patient's trip to Tahiti, then we're able to take that layer off our doctor and allow them to be more productive with their time, but yet the patient still feels like the doctor spent time getting to know them a little bit, okay? So at the transition, as soon as your doctor comes into the room, you want to instantly introduce the patient to the doctor and then the doctor to the patient. Guys, that's very important because at the end of the day, the experience is for and about the patient, right? And so you want to say, Susie, patient, this is Dr. Smith. Dr. Smith, this is Susie. We've had such a fun time together, even though she's in here because she's got a little bit of discomfort going on. We've had such a great appointment so far. I'm a little jealous. She just told me about a vacation she took. That sounds awesome. She's a mom of 4. And so I don't know how she's juggling it all, but she's like super mom and she managed to come in to see us. Now, how do you think that patient's going to feel? 1, you listen to them. 2, you're making it fun, so you're taking off a little bit of anxiety and nervousness that patient might feel. But now you're also communicating that information to the doctor instantly so the patient knows the doctor knows. Oftentimes we see this where, and docs, I don't fault you on this, okay? But hear me out. Oftentimes we see doctors where they'll say, I want that information before I ever walk into the operatory. That's totally fine. Most of our doctors do, to be fair. And so hygienists and assistants, when you go and communicate that information about the patient, the personal information, why they're there, the goals of the appointment to the doctor outside of the operatory, that's perfectly okay. But when the doctor comes into the operatory, it's vital that you restate that information in front of the patient, okay? Because it's not for the doctor at that point in time. They've already heard all the information. It's for the patient to rehear that information. See, whenever the patient answers you and you respond, they're hearing it multiple times. When you then relay it again in front of the patient to the doctor, they know that you're listening, but you're also respectfully, kindly, and in a polished way, telling them you don't have to tell the doctor this information. I've already told it to them. So we've heard it over the years. Sometimes clinicians will say, I feel like I ask the patient all these important questions and they share everything with me, but the doctor comes in the room and they feel like they need to verbal vomit all that information right back to my doctor, even though I've already told them. And guys, this will help cut down on that and allow you again to be more effective and more efficient. The other couple things that I want to point out before your doctor ever walks into that operatory, making sure that we're being proactive and we take any x-rays, whether it's a full set, bite winks, PA, pan, like whatever it is, depending on what the patient has going on. You want to make sure that you have the most important either x-ray or intraoral image up on the screen so that the patient can see, but also right when the doctor walks in, they're able to see it too. Now, docs, I know most of you like to do all of your research before you walk into the operatory. So you're already looking at the x-ray or intraoral in your back office, and that's fine. Again, it's for the patient, guys, so that that clinical transition is able to go fluidly. The patient knows exactly why they're there. You already have those images up on the television, and then your doctor, after pleasantries, getting to know the patient, understanding their goals for that appointment, then they can instantly look back at the television that the patient's been looking at for the last few minutes. They see that intraoral, they see that x-ray, they see the concerns, right? But now your doctor has it right there so that they can educate the patient also. So guys, if you need any help on how you should properly transition from the front to the back, please reach out to us. I know role play can be really awkward, but guys, grab a team member after morning huddle, grab somebody in your office and be like, okay, I want to practice role playing and I want to practice transitioning. And I'm really getting hung up on not asking, how are you? Like whatever it is for you guys, practice after a huddle. And I promise you, you will continue to grow. It will become more polished. And most importantly, you'll have more effective conversations with your patient. So as always, reach out to us if there's anything we can do for you. Please let us know. Otherwise, we can't wait to see you and serve you soon.